Imagine you wake up with a pounding pressure in your face, a stuffy nose, and now your eyes feel sore and heavy, almost like they are being pushed from behind. You might wonder if you are getting an eye infection or if your sinus infection is to blame. By the end of this video, you will understand how a sinus infection can cause eye pain, what symptoms to watch for at home, and when it is time to see a doctor for urgent help. Picture your face as a small apartment building. Your nose is the main hallway, and the sinuses are tiny air-filled rooms around it. Some of those rooms live right above your eyebrows, some live in your cheeks, and some sit deep behind your eyes. These hollow spaces are lined with tissue that can get swollen, irritated, and filled with mucus when you have a sinus infection or bad allergies. Because these sinus spaces are so close to your eye sockets, any swelling or pressure inside them can press on the thin bones and soft tissues around your eyes. That is why sinus problems often feel like pressure behind the eyes or pain around the eyes, even though the eye itself may be perfectly healthy. When a sinus infection flares up, most people feel facial pressure, a clogged or runny nose, and headaches. On top of that, you might notice a few eye-related symptoms. Your eyelids can look puffy or swollen. It may feel sore when you press gently around your eyes or brow. Your eyes might water more than usual or feel irritated and gritty, almost like there is sand in them. Sometimes, strong sinus pressure can even cause temporary blurry vision or make it hard to focus, especially if there is a lot of congestion around the muscles and nerves that control your eye movements. In simple terms, when the area around your eyes is swollen and tight, your eyes have to work harder just to do normal tasks like reading your phone. The good news is that in most healthy adults, mild to moderate eye pressure from sinus infections is uncomfortable but not dangerous. As the sinus infection improves, either on its own or with treatment from your doctor, the eye pain and pressure usually fade away too. Over-the-counter pain relievers, warm compresses on the face, staying hydrated, and treatments that open the nose such as saline sprays can all help reduce sinus pressure and ease the strain around your eyes. However, there are some eye symptoms that are not typical and should never be ignored. These are the times when a sinus infection can turn serious. If a bacterial sinus infection spreads into the tissues around the eye, it can cause a dangerous condition called orbital cellulitis, which is an infection of the eye socket. Call your doctor right away or go to the emergency room if you have a sinus infection and notice any of these warning signs. Severe eye pain, especially on one side. A swollen, red or bulging eye. Trouble moving the eye or double vision. Sudden blurry vision or loss of vision. Eye fever, stiff neck, confusion, or feeling very sick overall. These symptoms can mean the infection is spreading toward the eye or even the brain. This is rare but very serious and needs fast treatment in an emergency department, often with strong antibiotics through a vein and sometimes with surgery. If your main symptoms are sinus-related, such as stuffy nose, facial pressure, and mild eye discomfort, your first stop can be your primary care doctor, urgent care, or a telehealth service. They can help decide if it is likely viral sinusitis, which often improves within about 10 days, or a bacterial infection that may need antibiotics. If the sinus infection seems to be getting better, but your eyes stay red, irritated, dry, or blurry, it is a good idea to see an eye doctor. Optometrists and ophthalmologists can check your eye surface, tear film, and optic nerve to make sure there is no separate eye disease hiding behind your sinus symptoms. If this video helped you, consider liking it, sharing it, and make sure you subscribe for more easy-to-understand eye health explanations.